So this is the heart of a patient. It's a female patient that came to me because she was not breathing well. Her legs were swollen and she had chest pain. If you notice very well, the right ventricle is bigger than the left ventricle. This is another picture from a healthy patient where you see the left ventricle and rarely see the right ventricle. The left ventricle is supposed to be bigger than the right ventricle. But in our patient today, the case is reversed because the right ventricle is very prominent. That gives you the diagnosis immediately. There's a pulmonary hypertension and right heart stress. When I measured the diameter of the right ventricles, I get 4.2 centimeters, which in the case of that normal patient was just, what is it? 2.6 centimeters. The actually normal is only 3.4. But this our patient that is sick with shortness of breath, chest pain, and leg swollen has a 4.2 centimeter diameter of the right ventricle. That is not normal at all. Due to the distension of the right ventricle, the left ventricle is being compressed. The left ventricle that is supposed to be 56 millimeters or 5.6 centimeters is now just 3.4 centimeters, which is affecting the blood supply to all parts of the body. As you can see in our healthy patient, the left ventricle is just 4.1 centimeter. And as you can see on this slide, on this film, the right ventricle is very big, compressing the left ventricle, which is also obvious on this view. I will tell you what is causing all this problem and how you can go about it. As a result, the left ventricle now in the septal area is straight, giving it a D-shaped formation. Due to the pressure from the right ventricle, the left ventricle septal wall has been flattened, giving it a D-shaped formation. This is what it normally looks like in a normal patient. The left ventricle is round and there's no pressure from the right ventricle on the septum to make it flat. And to worsen it all, you can see the blue big flame coming back. That are reflux of blood from the tricuspid band. Instead of blood to be going forward, they are coming back so that the left ventricle is under stress. When the left ventricle is under stress, the blood that are coming from the leg into the right heart cannot enter because the right ventricle is already filled with blood and it's fighting itself and it's stressing the left ventricle. What is what we call pulmonary hypertension. And this patient is already going through right heart failure, which is causing the shortness of breath and the swollen legs and chest pain. There are so many causes of this occasion. But the main cause, one of the most common causes, is chronic bronchitis and chronic obstructive lung disease, which is mainly caused or mostly caused by cigarette smoking. Cigarette, they say, kills you slowly. This is an evidence of this. This person is not going to live for more than 5 years. When it gets to this stage, then it is irreversible because cigarette smoking has killed the structures of the lung, has killed the vessels of the lung, has reduced the function of the right ventricle, that has secondarily affected the left ventricle to not be pumping well, the blood supply to the heart, and from heart to other part of the body is being affected. So cigarette smoking is not good, and have a nice day.